Hi, and welcome back to the Integrated Rehab and Performance Podcast. This is another golf episode. This is golf episode 12, I believe. The assessing the rib cage for the 90-90 rotation test. So, the last episode we talked about the shoulder 90-90 test, and in this one we're going to dive in a little bit deeper and start talking about how the rib cage and the thoracic spine actually plays a role in our shoulder mobility. And again, this is something that the TPI test won't really look for. But again, we take things a little bit further, and we are going to make sure that the thoracic spine and especially the rib cage, which really kind of goes underlooked, is moving and functioning properly. We're going to look at breathing and things like that to make sure that that is not a limiting factor in our shoulder mobility as well as our thoracic spine and just overall trunk health and thoracic spine, rib cage health, mobility, and stability. So this is Dr. Nick here running the show at the Integrated Rehab and Performance Center. Thanks for tuning in. And let's dive into the rib cage and the thoracic spine for shoulder mobility and stability. So first and foremost, let's take a look at the shoulder 90-90 test again. Here we're demonstrating the upright position where we want to make sure that we can get to 90 degrees of shoulder external rotation, and what that looks like on this test is just getting the forearm to match the angle of the spine, right? So if we're standing straight up, we want the forearm to get right about there. He does a pretty decent job where we're right at about that 90 degree mark. And again, you can go back to the last episode where we talk a little bit more about what it means if you're short of that mark and between the ear and the nose, or kind of on the nose and then below the nose for the different kind of interpretations there, right? And that is looking at pure shoulder mobility. But we want to take this one step further. TPI has us look at the same test, but now we're kind of in that golf position. So you can imagine we're in a kind of, imagine you're holding your 6-iron, and then you just bring your arms up to this position. And so here we're mimicking what our scapula would be doing. They're a little bit protracted. And we just need to make sure that all the body can coordinate itself, especially here at the shoulder, while we're in these golf positions, right? So we do the same thing, but in this golf posture. And again, we're just looking for that shoulder to match the spine angle or that forearm when we get to the top there. And it just has a little bit slightly different challenges when we do it this way, right? So again, the two differences in that test, what we're looking for, pure shoulder mobility, as well as the whole shoulder complex to make sure that the scapula and the shoulder play well together, and that scap's able to not only get in the position it needs to, but that it can be strong, stable, and create motion while in that position, right? So important to check both things. But there could be some more things at play here, and that is the thoracic spine and the rib cage, and that's what we're going to talk about today. Check out the last episode for some more progressions of how to address some of these deficiencies if you're having some issues with the shoulder mobility test. Again, it's hard when you're at home to kind of pinpoint exactly where or what needs to be done, but we give you some good progressions to start with in that last episode. Again, always better get checked out by a medical provider, TPI provider especially would be best. All right, so we talked a little bit about why the shoulder 90-90 test shows the shoulder mobility versus kind of scap mobility / stability, and how the rib cage and thoracic spine are also kind of important factors that might go underlooked. Let's dive into that a little bit further. How does the rib cage affect shoulder mobility and our ability to get into a good backswing, right? The top of the backswing. How could the rib cage be affecting our ability to achieve that position and might be creating limitations or deficiencies that are limiting our ability to get there, right? Or compensations, right? Where we might have to actually stand up straight, things like that, because our rib cage isn't doing its job. Well, let me explain. The rib cage articulates at the thoracic spine, so that middle of your back, every segment that rib cage articulates with and connects with in that mid-back is your thoracic spine. Now, that wraps around the front of your trunk, and it connects, again, to the sternum, or it connects to some cartilage that eventually connects to the sternum, right? So we can think this might be a pretty rigid structure. It's all connected at one end and the other, but in fact, it can be still quite mobile, right? And so when we breathe, we actually get tilting, some backward tilting of the ribs. We get caliper motion, which is the ribs kind of opening up sideways. So if we imagining the ribs at the front of the chest kind of pulling apart or away from each other, and then the ribs kind of in the back are coming closer together. You can think of it like a caliper where the front starts to open and close, and then they also rotate. They rotate downward and upward, right? And we actually get quite a bit of subtle relative motion from each rib and each thoracic spine segment, and that's how they were designed. So what you might imagine is a pretty rigid area in the body is actually one of the most mobile, or maybe not the most mobile, but in the spine we actually expect to get a lot of motion from that thoracic spine and the rib cage. Now again, when we breathe and the diaphragm descends, we get a ton of motion through these ribs. They're expected to rotate inward, they're expected to come together in the caliper motion, they're expected to pull apart in that caliper motion, right? And they're expected to descend and ascend in order to create and then take away space in the trunk and the abdomen there to, you can think of it like squish the lungs to push air out, or create space to open up that vacuum to let air come back in, right? And so the muscles control how the rib cage moves, which assists us in our breathing to get air in and air out. Now, in most people, we stop using the diaphragm so well, and we actually stop getting the nice relative motion of rotation and upward and downward motion in the rib cage, but instead we just we use our secondary respiratory muscles, which are much more superficial and usually higher in the chest and in the neck, to just kind of pull the rib cage up and down, right? Instead of getting that nice rotation and keeping everything loose and moving through the rib cage. And a lot of people end up with a pretty stiff rib cage as we move along. So again, breathing is actually a great way of addressing rib cage and thoracic spine restrictions. Now, how does that affect shoulder mobility? Well, the rib cage is what the scapula sits on in that upper back. And this is a concave on convex surface, right? So the scapula are concave and they rest on the rib cage, which should be a convex surface relative to it. Now, when the rib cage gets a little stiff and it stops moving as it's supposed to, it changes the shape of the rib cage, and that scapula might not rest on the rib cage as well. And even more important is it won't glide and move on the rib cage in as much of an efficient way as we would expect or hope, right? And so when the rib cage stops working so well, we impact the scapula. Now, the scapula provides the surface that the shoulder or the humerus actually articulates with and connects. So if the scapula isn't able to move well enough, well, that's the other half of the shoulder, right? The humerus and the scapula. So this will affect our ability to get our arm out to the side, overhead, behind us, in front of us, across our body in that adduction like we talked about last episode. All those important motions depend on the scapula to get to where it needs to be and then continue to move in certain very specific and precise ways, as well as the muscles that are articulating from the scapula onto the shoulder to be stable enough, strong enough, and to be able to operate in that position well enough to create motion and then resist motion when it needs to, right? And this all starts with the rib cage and its articulation with the rib cage, as well as the thoracic spine when we're in an upright position to create this very subtle relative motion. It's very little extension at each segment of the thoracic spine, but there's 12 segments, so you add all those up and we get a nice upright extended position that allows the shoulder, when we want to go straight up, as opposed to us having to actually create more motion in the shoulder to mimic a direct overhead position, right? Because if you try to press something or get your arms out overhead and instead they're even slightly out in front, so think more over your toes than over your heels or your midfoot, even that slight change, imagine you had a heavy weight in your hands, you'd feel that and you wouldn't be able to really maintain that position. But if you put weight straight up overhead, right over your center of mass and right over kind of the midfoot, you can kind of lock your arms out and maintain that position much easier. And that's what we're always going to try to achieve in an overhead position, right? So if our thoracic spine isn't extending as well and we're not in as much of an upright position, our shoulder is going to compensate by creating more, in this case, external rotation or flexion to get over our heels, which will end up being past our spine angle, because that is what would truly be straight up and over our midfoots, right? So really important that we have the thoracic spine and rib cage, that we're assessing it first of all, and then able to address any limitations in here. And it's a process, and it typically requires lots of time, and there's lots of ways of progressing different exercises to get there. But here's a few starting exercises to get things moving and start really connecting with that rib cage again and feeling some motion in the rib cage to eventually benefit our mobility and stability up in the shoulder. All right, let's take a look at a few exercises that we can start with. This first one here, what we're doing, we're laying on our back in the hook lying position, so feet flat on the floor. This is a very technical exercise. Here we're simply just breathing, but what I want you to do is we breathe in through our nose, and then I want you to breathe out through your mouth like you're fogging a glass or a mirror, right? So breathing out through the mouth, very slow, just letting the air kind of fall out of your mouth, but we're going to do that until we get every last bit of air out. And when you do this, you probably have more air to push out, right? So really try to get every last bit of air, and you should feel your abdominals starting to work very hard towards the end, especially your obliques, and that's what we really want to target. It's not the rectus abdominis in the front, but really more the side abs starting to work really hard, and you should feel, and the very last bit as you're pushing out is the ribs starting to move together, and you should place your hands on your rib cage as I have them there to really sense those ribs starting to move inward and downward on top towards each other towards the end of your exhale, right? And so as you're exhaling, you should feel your hands start to approximate each other, and that's kind of the starting position. Now what's really important here is all that tension you've built up in your core and your obliques at the end of the exhale. I want you to maintain that. Think about maintaining like a 3 or 4 out of 10 tension through there. So whatever you were contracting at before, try to maintain about half of that contraction as you then breathe in through your nose again. And you should kind of resist the urge for your ribs to just flare open and kind of open up towards the sky, but instead maintain some of that tension that pulled them down and inward in the first place, and try to keep them there as you breathe in through your nose slowly and fully, right? And so we can do 5 or 6 breaths like this, and you should be kind of shaken pretty hard by the end of it, with the core working so hard to keep those ribs there. And I just want you to feel the ribs moving in on the exhale, approximating each other, and then only moving away from each other towards the very, very end of your inhale, right? And we just want to prevent them from shooting up towards the sky as we relax the abs, right? So keep them pretty tense, and then feel the ribs moving back only slightly, only because we filled ourselves up with so much air that it just has to push them apart slightly. Okay, so that's kind of that first drill there. And then we want to maintain that idea and that pressure there when we go into the next one here, where we're getting our scaps involved and we're really starting to open up that thoracic spine and rib cage, where we're going to pull our ribs down with our breath again. So we exhale, feel the ribs drop and come towards each other, maintain some of that contraction as we breathe in through our nose, and then all the while we have our arms. You see my arms aren't fully extended here. We're really thinking about pushing your elbows towards the ceiling as well as out towards the walls on the side. So kind of out and up, and that should pull your shoulder blades away from each other. Again, this can be a pretty technical drill. And from there, we're thinking about throwing your elbow up towards the sky as you come back and forth, right? And you see you don't need to extend your arms here. It's really thinking just pushing your elbows up and out as we rotate through there, creating space in that upper back, right? And again, that rib cage to start moving and articulating. And again, we're preventing our rib cage from flaring. You can see that the rib cage is still kind of down and tucked away here, instead of super open and hyperextended in the low back and that anterior tilt, right? Keeping that slight contraction in the core, keeping those ribs down a little bit, prevents us from anterior tilting too much through there, right? So we're getting really good motion through the ribs now that everything is kind of tucked away and the ribs are being controlled a little bit. Okay, so give that a shot. And then the last one here to really target that thoracic spine is we're in that seated position. I have my left foot over my right foot here, which means I'm going to rotate to my left. We rotate as far as you can, sitting up as tall as you can. Once you hit a block, you just tilt, kind of follow the angle of your shoulders straight down. So you'll see here, I just kind of tilt down, following the angle of my shoulders, hold that for 2-3 seconds, and then come back up, and then try and find a little bit more rotation. Good. Follow those shoulders back down. You can do this with a PVC pipe across your back as well. That kind of helps show you where you should be tilting. And then try one more time to get a little bit more rotation, and then tilt down again, following the angle of your shoulders, holding for a couple seconds, and then coming back up. All right, so this is some starting exercises and mobility drills to start addressing the rib cage, right? There's lots that we can do, and again, depending on a very precise and specific assessment, will depend where we start really and how quickly we progress and what other drills and exercises we throw in there as well. But again, the rib cage is important. Thoracic spine is especially important, and there's some other tests that will look directly at that thoracic spine. But otherwise, work some of these in if you're having some issues with that 90-90 test, and maybe even some other tests that we've done. Check out that last episode again to get some more shoulder and thoracic spine work that we did in there. And reach out if you have any questions. Always happy to help out. We have some practical examples here in the video podcast, as well as some information to start introducing you to some of these concepts that we think about every day when doing our rehab and performance training here. So thanks again for listening. We appreciate it, and we'll see you in the next one.